Hi, my name is Fatima Grace Amaran, a caregiver student from St. Augustine School of Nursing, Lipa. Today, I will show you how to administer, insert, and remove the NGT tube. NGT or nasogastric tube is a special tube inserted through the nose for delivering oral nutrition supplements and medication into the stomach. You are required to feed into the patient based on the feeding schedule. Please note of time, type of oral nutrition, supplement, and amount needed. Here are the equipment needed that we need in order for us to do administering NGT, nasogastric tube that is appropriate to the size of our client, syringe, lubricant. We have also the kidney tray, adhesive tape, the stethoscope, marker, steel tray, disposable sterile gloves, oral nutrition supplement as prescribed, a jug of water, strip on a small bowl, small cups, medication if any, and the feeding schedule. Perform hand hygiene. First is I'm going to check the doctor's checklist. Okay. Next is I'm going to introduce myself to my client. Hello, Mom. I'm Fatima. I'm gonna be your aide today. May I know your name, Mom? Rian. When is your birthday, Mom? Can I see your wristband? Okay, Mom, thank you. And then, I'm going to explain the procedure to my client. So for today, Mom, I'm going to do to you the nasogastric tubing. Is it okay with you, Mom? Okay, Mom, thank you. And now, before I start, I'm going to close the curtain, close the door for the privacy of our client. Now I'm going to assess the client abdomen because assessment determines the presence of bowel, sounds, and amount of abdominal distension. Okay, now Mom, I'm going to check your abdomen. Okay, Mom, you're doing good, Mom. Next is I'm going to perform hand hygiene. Then wear my gloves because hand hygiene deters the spread of microorganisms. A sterile technique is not needed because the digestive tract is not stereo and gloves protect us not to expose to blood or body fluids. And now, I'm going to assist the client on a high forward position or 45 degrees if unable to maintain an upright position because upright position is more natural from swallowing and protect against aspiration if the client should vomit. Okay, now I'm going to position. And then, after I position my client on a high forward position, I'm going to check the nostril and mouth of the client because tube passes more easily through the nostril with largest opening. Okay, Mom, I'm going to check your mouth and your nostril, your nose. See, Okay, Mom, thank you. Then I'm going to drape my client. And I'm going to put the kidney tray. Now I'm going to measure the desired NG tube to be inserted from the tip of the nose to earlobe, to the tip of the earlobe until here in the cyphus sternum. I'm going to get the NG tube. Okay, Mom, I'm going to measure from the tip of the nose to the tip of the earlobe down to the cephasternum. And then I'm going to mark this using a mark pen. And then I'm going to insert this NG tube to my client. Before that, I'm going to put a lubricant on it to make it easily to come in. Lubricant reduces friction and facilitates passage of the tube into the stomach. Now I'm going to build the client head back and I'm inserting the NG tube. When you feel resistant, give the patient a cup of water so they can sip and swallow while I'm inserting the tube. It helps the tube to come in easily. You can also twist it to push. Don't ever force it from resistance. Continue inserting until I reach the measurement and get a piece of tape and secure the tube. Okay, Mom. Swallow. Okay, Mom. Sip and swallow. So, okay, Mom. I'm going to insert. Now I'm going to insert the NG tube. Swallow, Mom, so that the NG tube will come in easily. Please. And when you reach the mark in the NG tube, you have to secure the NG tube and by using a tape. Okay. After we inserted the NG tube, be sure that it is secure by putting a tape or pin. And then I'm going to take my stethoscope and listen over the stomach, and we will be listening for the gurgling sound and whooshing sound. Okay, Mom? If you heard a whooshing sound, it means you put the tube in the right spot. And then we're going to, after we inserted the NG tube, the next procedure that we're going to do is the ND tube, and is the feeding. ND tube feeding. So now I already inserted the NG tube. The next is we're going to feed the client using the NG tube through NG tube feeding. Now I'm going to pop the patient at least 30 degrees. Ask the client to open her mouth and check the back of the throat. Please make sure that it's not coiled. Okay, ma'am, can you open your mouth for me? Okay. To check the feeding tube should be secured firmly to the nose and cheek with a tip. To check in a feeding tube, it is in the stomach. Withdraw some gastric content with a syringe. So now I'm going to remove the pin and kink. Going to put the syringe. Now we're going to, if you're unable to obtain gastric content, lay your client on their left side, inject 10 to 50 ml of air into the tube, and make sure another attempt withdraw gastric content. If you're still unable to withdraw gastric content, please wait 10 to 15 minutes and try again. Read gastric content pH level. If below or equal to 5, she's already to be fed. Then I'm going to check the feeding schedule. Okay, mom, you're ready to be fed. I'm going to close this first, and I'm going to prepare the feeding for our client. The feeding schedule: prepare the correct amount and oral nutrition supplement prescribed by the physician. We're going to check the expiration of the food. Okay, now I already prepared the food or the supplement that I'm going to give to my client. Now I'm starting to feed her. I'm going to remove the pin, and I'm going to kink the feeding before connecting the syringe. Flush the tube with 20 ml of water as prescribed. Feed according to the feeding schedule. Position the syringe slightly above the head. Ensure that the syringe is not empty this is to minimize stomach discomfort due to excessive air. Complete the feeding, flushing 20 ml of water. As prescribed, and close the feeding pot with a stopper. The client will remain seated for at least 1 hour to prevent gastric reflux. Okay, I'm going to put a stopper. I'm done, and I'm going to put a stopper. Okay, after we fed our client, I'm gonna do the removing of the NGT to the client, and then, okay, mom, I'm going to remove your NG tube. Is it okay with you, mom?
Yes.
Now I'm going to remove the tape. Ask the patient to take a deep breath and hold it for a moment. Okay, ma'am, I'm going to remove your TNT tube. Take a deep breath, ma'am. Okay, ma'am, thank you. And then dispose it in an appropriate receptacle. Offer the patient a tissue and oral hygiene. And then I'm going to remove the drape and put in the laundry hamper. And I'm going to remove the gloves, do hand hygiene, record and report. Thank you.